Hi ladies, we're going to talk about scar tissue mobilization for laparoscopic scars today. So scar tissue is the tissue that is laid down as a wound is healing so that the skin, the muscle, the fascia, the organ the nerves can all come back together. It is laid down the way tape is put on a present wrapped by a 7-year-old. Every which way, and it definitely accomplishes things being brought together, but it's a little crazy. And so it's not necessarily very flexible. It can feel very inflexible and really, really firm. It can cause pain farther away because of the stretch that it might put on your tissues. It can cause pain right there. It just depends. It's different for every person. So I'm going to show you scar tissue mobilization because that can be a big driver in people's pain after surgery or after a tear, even like from childbirth. That's not going to be laparoscopic at all, but it's still scar tissue. So I don't have any laparoscopic incisions or laparoscopic scars. However, I do have a smallpox vaccination scar that I got before deployment. So it shouldn't look like this. It should have been, and it used to look a lot worse. But I was teaching fitness classes at the time, so I was unable to exercise to a light level like they suggested for 2 weeks. So I was getting mega sweaty underneath that waterproof bandage every day. So what happened to what should have been a small little wound that they created? It got massive. It was a nasty boil, and it left me with a big old scar that was painful when I touched it. So what do we do for a scar like that? We got to get it flexible. How do you get it flexible? You got to massage it. You got to press on it. You got to pull it back and forth, push it in and out, and that's what we're going to do. So you can take 1 or 2 fingers, go to your laparoscopic scar. This is going to be too rough probably for a scar down in your perineum, so I would hold off doing it there. So go to your laparoscopic scar, and everyone has different sensitivity levels, so do what you feel comfortable with. You can go into some pain, but I do not want this to be something that leaves you in pain for longer than when you're doing it. It shouldn't really hurt afterward. Take your fingers. We're going to go in some circles. I'm using moderate pressure. So you use light or moderate pressure, making circles all around that scar. And then let's go the other direction. Light to moderate pressure, depending on your sensitivity level. And just notice how the tissue around it moves, because the scar is connected to the tissue around it, but we're hoping to make it a seamless connection, not one that's all taped down every which way. So now let's go back and forth. I'm going to put the very tips of my fingers on it, and I'm going to just pull it back and forth, back and forth. Now I'm going to go up and down. Again, light to moderate pressure. This can also help because as nerves regrow in an area that they were cut, as little itty bitty cutaneous nerves are cut when someone has some sort of procedure, this can help to normalize their sensation as well. It's pretty typical to have itching as your nerves regrow. Good, and then let's go back to the circles. So you might be starting to get a bit of an ache there if you didn't get a little bit of an ache earlier. So I wouldn't necessarily increase your pressure at this point. Keep it light. Or if you feel like you're done for the day, you're done for the day. 2 minutes. No, we've been in this for 4 minutes. So 3 minutes of this, we've been doing scar mobilization, reverse direction. So you did fantastic. You don't have to sit there and do it for 5 minutes. You can do it for 30 seconds a few times a day, and it's going to make a difference. And let's stop. Okay, so again, this is to increase the flexibility of that scar and all of the surrounding tissues because they are getting pulled on like a snag in a sweater, and we want to release that extra tension because that's going to allow the myofascia to actually operate in the way that it was meant to, not being pulled sideways and so while it's trying to do its regular job. Okay, leave a comment if you have any questions, and have a great day. Go Vols!